Hi, and welcome to the March edition of This Month in Telemedicine, March 2017. I'm John Linkous, the CEO of ATA, and in a few minutes, Gary Capistrant, our policy director, will be joining us to give us a little bit of information of what's going on in Washington with some of the policies, and I'll give you a couple of comments on that before we get to Gary. Of course, everybody this week in ATA is getting ready for our annual conference, which is going to be in Orlando, Florida, on April 23rd through 25th. I certainly hope to see you there. If you have not registered yet, just a little note, the advanced registration is closing on March 25th. So if you want to save a buck or two, make sure you get online and register today. Also, hotel rooms are going out pretty quick, as I understand it. It's going to be, I believe, another record breaker for us. It's almost a record breaker already with the exhibits. And in terms of attendance, there's going to be lots of folks. So I hope to see you there. That's coming up again, April 23rd through 25th. Well, this is Washington, and there is a lot of things going on in Washington. Of course, the start of a new administration. There's been a new members of Congress. There's a lot of stuff that's going on. Has been announced. The tweets are flowing freely, and I'm sure all of you have known all of that has been going on. But the question is, what does it mean for telemedicine? Well, it's a little bit early yet for a couple of reasons. First of all, a lot of the appointments for the agencies have not been filled yet. There's not even a lot of word in terms of who might be appointed to some of these programs. HRSA, the Health Resources Services Administration, which is in charge of a lot of the healthcare programs, there's no head of that right now. The Office of National Coordinator, another part of HHS, has not been filled, and there's not sure about when that's going to happen. Of course, Tom Price has been appointed and confirmed by the Senate to be the Secretary of HHS. And Seema Verma is, as we record this, is about to be confirmed by the Senate as the new head of the Center for Medicare Services. But again, we're still early on, and there's a lot of discussions about a lot of other policies. In terms of healthcare, there's a lot of discussions, but it's really kind of hard to read the tea leaves right now. In the State of the Union address, President Trump did talk about the healthcare reform. He did make a few comments about it, but he didn't really get specific on some of the details, other than he did, again, mention his support for getting health insurance policies that are available throughout the country. That could have a significant effect, and it could be helpful for telemedicine, as some of the insurance companies that are very positive on telemedicine are allowed to be providing their policies in other states if that's enacted. Again, we're a long way off before anything getting enacted, but there's a lot going on, and we'll see what happens. And speaking of public policy, this is the time of year with the new administration, the new Congress, that a lot of the interest groups come out and petition for whatever their interests happen to be. Certainly ATA is doing that as well. It's interesting, this last week or so, we've had a couple of letters coming in from medical societies. AMA and a number of specialty societies and state societies just wrote a letter to CMS asking them to delay the newest certification requirements for electronic health records. There's requirements that cause for EHRs to be certified under the new rules, and there's new rules that have just come out. But the problem is a lot of EHR vendors have not been certified yet. There's only been 54 certified so far under the new rules. The feeling by the medical groups is that there really isn't enough choice yet. So they've asked CMS to delay that for at least a year. We'll see what happens with that petition. Also, interestingly, this last week we've had a letter sent out, again, by a number of medical societies asking that CMS delay stage 3 meaningful use. You might remember meaningful use is what the requirements are, that if you are a provider, you meet these types of requirements for implementing your health records, allowing your patients access to the health records, allowing a lot of the other things that are related to it. Stage 3 meaningful use has been criticized, has been talked about for a year, or actually longer. So it's not a surprise that people have been asking for a delay. The question is, how long will that delay be, if it will be enacted ever? So the new Secretary of HHS, Price, has been very critical of meaningful use stage 3, saying with all these new requirements, doctors have been spending more time entering data and looking at data on their laptops than they have been spending with patients. So it's going to be a very controversial area that we'll look at just coming up pretty soon in this year. Also, I'd like to welcome a number of new members of ATA. We now have close to almost 450 organizational members, about 250 corporate members and 190 organizational members. Organizations meaning health systems, hospitals, a lot of the provider groups. There's a lot of groups, and there's a lot, fortunately they're growing a lot. So this last month we've had the Hartford Healthcare, First Healthcare of the Carolinas, Genoa Telepsychiatry, Tu Salud Virtual by AMG Virtual Health, and Concentra as just some of the organizations that are coming on this last month. I want to welcome all of you to the ATA fold. It's a great time to be in telemedicine, and it's a great time to be part of ATA right before our annual meeting and joining the other people that we have, not only the organizations, as I mentioned, we have almost 10,000 individuals that are part of ATA as well. So it's a growing network, and I look forward to meeting or hearing about a lot of you over this next year. Thank you. And before we get to Gary, I'd like to add a couple of comments as well. My favorite quote that came out of an industry magazine this last week is, "The digital health sector has a tendency of getting ahead of itself with the buzzwords of the year, continuously changing whether the problem is solved or not." And boy, that really sums up a lot of what we see here. At the last count, it was telemedicine, telehealth, e-health, m-health, connected health, digital health, virtual health, remote health monitoring, and any number of things that are associated with the specialty. Tele-ICU, telepediatrics, teleradiology. There's any number of, whatever you call it, it's telemedicine, or if you want to call it something else, that's fine. We don't really care. The fact is the market's growing, the industry's growing, and we're growing as well. And so I'm glad to hear all that. Finally, Gary, I just read an article about how they just came out with a new find of a fossil that showed that life began on Earth 3.8 billion years ago. Now, I don't quite remember that, but it might have been around the time I was out having a snack in the refrigerator. I don't know, because they haven't really done the testing on my place yet. When they do, they might change that.
Or the office refrigerator.
Or the office refrigerator's got to be definitely older than that. Gary, what's going on in Washington?
Well, hopefully we're starting to make some progress on some more current events. As the new Trump team gets into place, Secretary Price, Secretary for Health and Human Services, Secretary David Shulkin for Department of Veterans Affairs. The whole cabinet is now filled in and starting to fill in the sub-cabinet positions, like the head of the Center for Medicare and Medicaid, Seema Verma, and starting to see some proposals put on the table about the repeal and replace for the Affordable Care Act. And involved in that will be likely involve heavily changes to the Medicaid program. House Speaker Paul Ryan had a draft got out of his proposal from a couple weeks ago with some of these details. So we're starting to see some of that. They want to move forward the repeal and replace as part of a budget reconciliation process, which is a fancy word for a fast-track process that Congress has to move matters forward. That could, the emphasis on fast, that could happen in a matter of months. So major changes to the Medicaid program. One of the things that they seem to be looking most at now is some kind of per capita limits on different components of the Medicaid population and moving forward with that. Later this month, we'll get more details on the president's budget and what implications that has for Department of Health and Human Services and obviously all of the other departments. We start getting into some of the congressional battles on those difficult issues, like increasing the amount of to compensate for the debt that the country has. Right now, Medicare seems like it's not going to be something that in the short term there's significant structural changes to. Certainly we continue to be optimistic in pursuing some telehealth changes. I should mention on Medicaid that the Center for Medicare and Medicaid Services just put out a request for information about pediatric innovations. So some of our special interest groups, like the Pediatric Special Interest Group, Telemental, and Telerehab, are working together to put some proposals on for innovations. Certainly some of those things could be moving into health settings or health settings outside of the health space, like school-based care, at home, at rural stores, specialty care networks, other things like that. If you're interested in participating, please do that through the special interest groups, pediatrics, telemental, and telerehab in particular. There may be others that get involved.
Gary, I have a question. So we reported last month that CMS now has a new code that they're putting in place in terms of the location of where you're providing. I think it's O2 or something like that. Do you think that may be a precursor to the idea of opening up where you can get telemedicine beyond the hospital? Is that at least putting in place the structure for something like that?
It could. The whole issue came up because it used to be that the patient and provider were at the same location.
Sure.
And now that they're at different locations, that old school thinking and the form didn't fit, the paper form didn't fit the reality for things. So it may be facilitating that kind of a move.
So knowing how CMS works deep in the bowels of the bureaucracy over there, I think getting the paperwork changed and the forms changed could be a major earthquake in terms of the policy changes that are to come ahead.
It does help. We will have a Telehealth Capital Connection. That's our congressional briefing series the end of this month on the 28th. This will focus on mental and behavioral. It is open to ATA members. It will be something that will be recorded in some version and available for viewing by you at some other time. Before getting into some of the state details, I should emphasize that because of all this activity about the Affordable Care Act and healthcare in general, the members of Congress are very interested in healthcare, but also a lot of the issues are very contentious. Telehealth is not one of those contentious issues, and so this is a great opportunity for you to try and meet with your two senators or your representative and to explain about telehealth. Telehealth is seen as bipartisan. It's very responsive to what your needs are, what the public is, and so this is a prime time to end up both fitting a congressional need for information, but also our need to promote telehealth. This would be a great time to get involved.
And I would add that if you do take the opportunity to visit with your elected representatives, either in person in Washington or back in their home office or by telephone, whatever, any information you might pick up from them, give it back to us, if you will, because it's really critical. You are the real strength of ATA and what you're doing with your congressional representatives. So thank you, Gary, for pushing that. It's really critical.
The easy way to communicate is the main mailbox, info@americantelemed.org, and they will be sure to get that to those emails to me. Some details on the state level. First of all, the next state policy webinar will be on Thursday, March 23rd. It is something that you need to pre-register for, so a link can be sent to you. Certainly the states are moving forward. Almost every legislature is in session now and moving forward on the Medicaid theme. Maryland has a bill that would expand their coverage of telehealth under Medicaid. I testified before the General Assembly and the Senate last week on that. 7 states have parity bills already. Of course, we've got 31 that have those already in place. So, now we're looking for maybe some of the states that issue is a little bit more difficult, but those 7 states, Iowa, Idaho, Kansas, Massachusetts, Nebraska, New Jersey, North Dakota, and West Virginia. One of the things that we're finding is some states are coming up with almost going backward in terms of coming up with barriers for telehealth, like the requirement for an in-person exam to start a relationship. We've had to send letters to Connecticut and New Jersey recently, where such proposals have been moving forward. Also, in terms of the licensing boards, a number of states are getting very much into unnecessary detail about the technology involved or what the standards of care are. And this is an important point to remind people that our view basically is that it's healthcare, and it ought to be handled the same as in-person care and not saddled with a lot of special requirements for telehealth. And it would make things a lot easier for everybody. A lot of material on particularly the State Policy Resource Center. We've got a tracker there for you to be able to get information about what's going on in your state in terms of legislation, in the state legislature and in regulations. And of course, the so-called matrix that's there, the kind of to give you the highlights of what's going on at the state level. So we're early in the year, but a lot of activity is already happening that's going to be good for telehealth.
So it's a good start to the year here in March. And the weather's warming up, and so is the politics. There's going to be a lot more to come. And Gary and I will see you next month in Telemedicine.